thing what's unique about the Yale Interventional Pulmonology program is that we are one of the largest program in Northeast, and the amount of the support that we have and how well we work with the thoracic oncology group is really sets us apart.
Here at Yale, we're surrounded by experts in thoracic disease, both in the oncology department, the thoracic surgery department, and within our own interventional pulmonary program. We are the only interventional pulmonary program in the region, which means all of the disease processes within the region are referred to us.
Our procedure education is comprehensive. We have a real focus on pleural disease, which makes us unique compared to other programs.
The things that we do most often is a procedure called a thoracentesis, draining fluid from around somebody's lungs, and also bronchoscopy. Those are probably the workhorses of our program.
Within the bronchoscopy program, we do all types of bronchoscopies, rigid bronchoscopies, flexible bronchoscopies, a newly added robotic bronchoscopy program.
We are frequently involved with biopsying the lymph nodes in the chest, called endobronchial ultrasound or EBUS. That allows us to sample lymph nodes and determine whether or not somebody might have cancer or other diseases in the chest that may have spread to the lymph nodes. The Yale IP fellow, myself having been one here, gets up in the morning and reviews cases for the day, is involved throughout most of the day in cases in our bronchoscopy suite, doing bronchoscopies, but is also involved with any patients in the hospital that we might be managing.
I often say that we have the best relationship with thoracic surgery of any fellowship program in the country. Our fellows spend usually 2 weeks with the thoracic surgery service, rotating with them and learning from them and doing their procedures.
We work very closely with our ENT colleagues, ear, nose and throat colleagues, and we work very closely with the thoracic surgeons. We often go to OR with them and do a combined cases, for example, which speaks a lot about our multidisciplinary approach at Yale.
New Haven is really a great place to work and live. There are great restaurants, there's lots of culture because Yale is here.
I came here about 8 years ago to New Haven, and the things about the area that I really loved were the benefits of a big city but without living in a big city. 10 minutes away and you can be hiking up Sleeping Giant or East Rock. It allows you to do a lot of things outdoors and have the space to do it, but with all the amenities of a big city.
So if you choose to come to Yale for your IP fellowship training, you're gonna be part of the IP family from get-go, and you're gonna find lifelong friends and lifelong mentors. You're gonna get an excellent training in interventional pulmonology. You're not gonna just become an excellent interventional pulmonologist, but you're gonna be so well trained that wherever you decide to go, either in a community setting or an academic setting, you'll not only be able to provide an excellent care, but you will be able to start an excellent program and teach your trainees and teach your nurses and respiratory therapists and technicians.
Our fellows have gone on to establish academic interventional pulmonary programs at institutions that previously there wasn't a presence. They've joined other academic programs and joined community practices as well.
I think that's a real testament to the breadth of procedures that we do, and we really prepare them for any job that they have afterwards.